There we go. Thank you so much for giving us a couple extra minutes at the beginning here, everyone, and welcome to the Quarter 4 Maternal Child Health Action Team meeting. Once again, the meeting is being recorded, and so, there are slides for pretty much the whole meeting, so you're welcome to leave your camera on or off. Just whatever your preference is, but please just make sure to double check your mute button unless you want to come off mute and speak. Here is a quick agenda. We'll go over kind of the basics of MKE Elevate, just for any new folks in the room. And then we'll do a little icebreaker and introductions activity. We are going to do a little bit of voting for an MKE Elevate champion. And then we're going to hear from our implementation partner, Chris Paterka with iCare. After that, we're going to have a partner activity survey, and then you guys are going to get some updates towards the end. Now that I say it out loud, it seems like a lot, but I went through the time, so hopefully we'll be all good. To do a little bit of MKE Elevate background, MKE Elevate is the name that we at the health department gave to Milwaukee's CHIP, which is Community Health Improvement Plan. These are plans that local health departments come up with, typically on a cyclical pattern, and so ours go every 5 years. It is a community-driven plan to improve the health and well-being of Milwaukee residents, and we do want it to be by the community and for the community, which is why we always appreciate participation. And so the community selected priority areas are what the action teams are, like this maternal and child health team. And then there is an overarching priority of addressing racism and health equity. And the vision of the whole thing is a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods. My arrow buttons are being a little slow. On this team and with MKE Elevate as a whole, we have a handful of shared agreements just to make sure we're all being welcoming and equitable in these spaces. So we like to, as a whole team, step up, but then also step back. We want to remember to respect each other's time and expertise, and we support each other's learning process because we're all at a different stage as we are going through the community health process. We do want to elevate the expertise of lived experience as well, and we want to listen to understand and support rather than simply listening to respond. And our North Star is always at the center of it, and that is the health of all people and neighborhoods in Milwaukee. If you see anything that references an anti-racist lens, here's a little description of what that is. We want to understand personal privilege and biases, and we want to commit to learning and developing a shared language around racial and health inequities, and then identify opportunities to reduce those racial disparities. So for our icebreaker and introductions, when we're on Zoom, I like to do randomized groups so that folks have some time to actually chat with some people and get to know someone. So we will do randomized breakout groups of 3 to 5 people, and we'll be in those groups for 5 to 10 minutes. Let me double check my timing right now. Oh yeah, we're doing good. 5 or 10 minutes. And we're going to go through your name, your organization, your window of tolerance, and then an icebreaker question. For those who aren't aware of the window of tolerance, that's what this little thermometer graphic is. We've got being in the window, which is the optimal zone. We're feeling calm and alert, and we're receptive to new information, and we're open to sharing and things like that. We can be in the elevated hyper arousal where, we're at that kind of top level. Maybe we're feeling a little anxious, a little too energetic. It might make us feel a little defensive or, maybe not so receptive. And then at the lower end, there's the hypo arousal. It's a gloomy day out. Maybe it's been a long week so far. You might be feeling a little tired by this point. I greatly appreciate all of you being here, but maybe it's making you feel a little less attentive than usual. And all of those are okay. It's just good to kind of check in and see how we're doing. And then for the icebreaker, if you could eliminate one thing from your daily routine, that's supposed to be routine, what would it be and why? So for my introduction, I would say my name is Melissa Seidel. I'm with the Milwaukee Health Department. I'm pretty much in the window of tolerance, feeling pretty good. And if I could get rid of one thing, I would get rid of showering because personally, it feels like a waste of time. It's annoying. It's a hassle. If I could just like push a button on the wall and beams would just zap me showered, I would be happy as a clam to not have to deal with that anymore. So I will stop the screen share and um let's get some randomized breakout rooms going. And we'll come back at 4:20. Oh, thank you for putting the questions in the broadcast there. That was smart. Hi, Katie. We are just in some randomized breakout rooms doing our introduction and icebreaker. So that is name, organization, kind of where you're at in the window of tolerance. So are you feeling comfortable and ready, receptive, or are you a little stressed? And then icebreaker question for folks. If you could eliminate one thing from your daily routine, what would it be and why?
Oh, that's a
So
good question.
I know I saw it on a list online and I was like, ooh, love it. Yes. Um, so Kong, are you able to put her in a random
Yep.
room?
I'll send it to him.
Thank you. What thing would you eliminate from your daily routine, Kong?
For me, probably be probably commuting or uh like cooking. Like I like cooking, it's a love and hate thing.
Fair enough. I'm not a big fan of cooking, so
I like to cook, but clean up and like thinking about it, it becomes a chore eventually.
The planning is definitely a hurdle. I actually don't terribly mind cleaning up. My family was like, if you cooked the meal, you don't clean up, and if you didn't help cook, you are on cleanup duty. And so I was always fine to be on cleanup duty. Like, that's fine. I did not have to prepare this meal.
Mhm. Yeah, think about it. I think for me, definitely commuting. That's the worst. Like, I don't mind being in the office, but just the thought about getting ready and hopping in the car and then worrying about traffic.
Hmm. Do you have to take the freeway on your commute?
Yes. Hmm.
Yeah, that's tough.
Yeah. Yeah. So like
I'm lucky
now
now that I don't.
yeah, at Northwest, I don't have to because it's just like 10 minutes
Sure.
away, not even. But Z&B, like, I didn't mind being at Z&B, but parking kind of it wasn't the parking wasn't the best when I first started, and the commute was horrible. So
Yeah. Yeah, anytime the freeway comes into play during like regular commute hours, it's just dodgy.
but okay, you said you wanted the group back at 4:20, you said?
Yeah.
Okay. Yeah, I don't remember if you end the meeting, I think you give them like 30 seconds to a minute on Zoom, right?
I think it's usually a minute.
Is it a minute? Okay, so I'll broadcast that in like another minute. Oh, oh, there it goes right there. Okay. Oh,
Hi, Lakita. We are just wrapping up our quick introduction and icebreaker breakout groups. They're going to be coming back in a minute, I believe. Um, the icebreaker question we did was if you could eliminate one thing from your daily routine, what would it be and why? Do you want to share with us? Okay, sounds good. I saw you in the chat there. And if you have to drop off or anything, I understand. Looks like a couple groups are still chatting, so we'll let them be pulled back naturally by the Zoom.
Oh my God, you guys, what are you trying to do? I was just in the Press Center all day. Oh my God, what? Good. That's good. For who? What?
All right. Looks like everybody's back. All right, you guys can, if you would like, you can feel welcome to put at least your name and organization in the chat, just so that other folks who were in different rooms as you can kind of see what types of organizations we have in the room. And if you would like to share your icebreaker, you can put that in the chat, but at the very least, you're welcome to put, who you are in your organization, because I think we do have some new meeting attendees, so it might be helpful to kind of see what kind of representation we have here. And in the meantime, I will refigure out my screen share again. I've already done it. It's the only green one. You would really think that, this would stick a little bit better. All right. So next we are going to vote for our MK Elevate champions. We started this last year, and so we like to recognize the folks on our action teams who have been, you know, a champion, as it were, for the community and for their action team health area. And so the champions are going to be recognized at our general member meeting in December. And so we're going to vote for those folks who are helping to create a Milwaukee where, again, all people are thriving in safe, healthy, and equitable neighborhoods by working to align our strategies and build power, partnerships, and access to resources and opportunities for our collective advocacy. We did have some selection criteria, so think about the folks who were actively involved, particularly contributing to work groups, if you know that, folks who have demonstrated commitment and engaged in meaningful community action, and then the people who are working towards equity. So I do have the link prepared. You can click that link in the chat to go to the voting form. Everyone who is a nominee, if you would like, you can also scan this QR code. The nominees are going to be listed on the voting form, so you'll see a kind of a block of text that's listing the names for each action area. So you're going to vote for the steering committee first, and then it'll go through the action teams. And you'll be able to read the nominations so you can kind of see who's on the list there. And then you'll be able to vote in each action team. I also have them on slides here so you can read on your own screen, and I'll also go through them slowly on here. So the steering committee, who are the folks who oversee our racial and health equity goals. We have Maddie Day from 1MKE. We have Musa Yahaya from the Zilber School of Public Health. Susan Hjelstand, I'm sorry, I've never actually heard you say your name, Susan, with the American Heart Association, and then Benjamin Porter with the Greater Milwaukee Foundation. And again, these folks are with the steering committee working on racial and health equity. The slides for built environment are going to be on 2 slides. So we've got Celia Jackson for the Coalition for Safer Driving MKE, Beth Van Gorp with Habitat for Humanity, Crystal West with Amani United, the team at the Wisconsin Bike Fed, including Alora Correa, Michael Anderson, and Rachel Gucci, the team at 1000 Friends of Wisconsin, which includes Ralphie Toralba and Carl Glazmeyer, and then the team at American Cancer Society, including Alicia Renflesh and Kimberly Abel. Our maternal and child health nominees for champions are Allison Chavez Stewart with Planned Parenthood of Wisconsin, Dr. Cherokee Jackson with Empowerment Beyond Loss, and Christine Alstrup with MetaHouse. And then we have 2 pages for our Safe and Supportive Communities nominees. We have the team with Lutheran Social Services, Kim Polke and Amanda Kay. We have Tahira Malik at Samad's house, Crystal West again with Amani United. Some folks are involved in multiple action teams. Leilani Lopez Blasini with the Comprehensive Injury Center, Vinicia Kendricks with the County Children, Youth, and Family Services, and then Kim Lombard at Frederick Hospital. So again, if you were relying on the screen, all of those nominations are also listed out in the voting link, which can be found in the chat. Let's do some thumbs up if we're done voting. So 1 video thumbs up. If you still need a few minutes, I know some of the nominations are on the longer side, so it took me a little bit to read through them the first time as well. And again, I know it's hard because most of you are involved just in the one action group, but you are more than welcome. You are invited to please read the nominations and cast your vote for the other action teams as well. All right, you can continue having that open. You can keep looking that. We are gonna move on to our partner presentation. We are gonna be hearing from Chris Paterka today. She is an implementation partner and active on our Healthy Birth Outcomes work group, and she is a population health lead with the I Care Medicaid HMO, and she's going to be able to explain that much better than myself. So I will stop sharing so that Chris can take over.
Great, thank you. Good afternoon, everyone. I'll share my screen here. I'll pull my slides up. It's nice to be here with all of you and tell you a little bit more about who we are. And if you have any issues with the slides, let me know, because I think as we talked about in our small group, I think a few of us are on the hypoarousal and it's been a long week. I don't know what it is for everyone. So thank you for letting me talk to you a little bit about iCare and who we are. So I'll explain who we are. But actually, I'd like to, so first, my name is Chris Paterka. I'm a population health lead with the iCare Independent Care Health Plan Medicaid HMO. And I'm going to talk a little bit about what Medicaid HMOs are. I'm a nurse by background. I have worked here in the city for my over 30 years of nursing career. And so I'm really happy to be here with all of you. So I'm going to just give you a little bit background on who we are. And so as you can see, there are a lot of names on this first slide. So iCare Independent Care Health Plan was a tiny little plan here in the state of Wisconsin that worked with all Medicaid folks. And we were fully bought out by Humana a number of years ago. So we've got this bigger company that brings a lot of extra resources for us, but we're part of Humana. And then we acquired another program, a family care program called Inclusa. So we have three names. We have incredible confusion over who we really are, but I have all three names on our slide here. So I just wanted to go through. So iCare is a Medicaid HMO in the state of Wisconsin. We have a number of different Medicaid products, they'll call them, in the state of Wisconsin. We have members who have Medicaid because they're on SSI and they can choose us as an HMO. That's this first one. And we've been that type of company since 94. Inclusa, our sister partner, has been a family care company since 2000. And so family care is one of those long-term care programs that you have Medicaid, you're eligible for Medicaid, but you're functionally now struggling to really be independent in your home. So you can get this extra Medicaid dollars through waiver funds, like a family care program, an IRIS program, family care partnership. So we have one of those. We also are a Medicare plan. So some people who are in Medicare have also Medicaid. They're called the dual eligibles. That is one of our plans as well, although that is winding down at the end of this year. The one that's probably going to be more appropriate for our conversation is that we are a Badger Care Plus HMO as well. So those moms, those kids, those pregnant people, if they are on Badger Care, they can choose iCare as their HMO. And then we also have a family care partnership program, which is again a Medicaid program that if you have Medicaid and but you're starting to decline and you need some more support, you can have one of these long-term care programs. So all of this is super confusing, and I have been in this business in this role or at iCare for 14 years and know how confusing insurance is and all of that. So I thought I would do just a little bit of background on just kind of what HMOs are and how they function. Let me go back in our state, because it is very, very confusing. I also will tell you that Medicaid HMOs, I have to be very careful. I am not selling our eye care, encouraging anybody to sign up here. We have very strict rules in the state about any of the HMOs kind of marketing themselves. So I really want to do this as more of a little bit of an education on what is an HMO, what are our responsibilities if we're a Badger Care HMO, because all of you probably work with members, clients, individuals that have Medicaid. They probably are in an HMO. And so HMOs sometimes are an extra partner for you to reach out to say, what kind of resources can I help this person get? Because we have a tremendous amount of resources sometimes, and there is care management that happens. And so we can be pulled in for certain conversations or certain supports. I want you to know a little bit more about that. And then if you have any questions after this and you want to reach out to me just to chat about how all that works, please feel free to reach out because it is a confusing system. And I strongly believe that the HMOs should be at the table a little more often than we are. So,
And there is representation of some of the other HMOs on this action team as well. But I got the interest list of partner presentations a while ago, and it was first come, first serve, and Chris was next on the list. So I am also not trying to play favorites. We do have some of the other ones on this team.
thank you for that. I appreciate it. And if any of those partners want to chime in at any time, please do. I would appreciate the support. You can correct me. So, so I do want to just talk a little bit about Badger Care, and that because again, that is the Medicaid that people can get in our state, in the state of Wisconsin, if you are an individual that makes up to 100% of the federal poverty level, or it's a little bit more if you're pregnant or children. They're higher poverty, the income levels for them to be eligible. But if you do meet those income eligibilities or you're in one of those categories, then you can apply for Medicaid and if you get on Medicaid, you've got it. That's great. Once you're enrolled into Badger Care, what happens is there's really two ways you can get your coverage. One, you can stay fee for service. The other is you have to choose an HMO. And an HMO is a health maintenance organization. That's who we are. We are these companies that are set up to really manage all of the health care that people get. So the state pays us, if we have a member in our plan, the state pays us, like they call it, a per member per month. We get, I don't even know what it is, but I make about $300 per member per month. We then get that money in and we have to manage all the members' costs, pay all the claims, all of those things out of that cost. You can see as a business model, the business is incented to try to not pay as much of that out because some of that then we can keep, and that's that money that we don't use is how we pay for salaries and a bunch of extra things. So there's incentive to really keep your members healthy and to support them. As a nurse, as social workers, as community health workers that work in our plan, that kind of helps us because we're like, if you let us nurses and let us social workers and our community health workers do what we do best in trying to keep people healthy, then we do actually show that we can save costs. Now, I will tell you the state is very strict about how much profit we make. We cannot make a ton of profit on people. Once that extra money starts to get a certain level, we get penalized and we have to put that money back in towards members and providers and things like that. It's a really highly regulated system. So I'll back up. So again, you get into Badger Care, usually you either go fee for service or you have to pick an HMO. Fee for service means you're not in an HMO and basically the state pays all your claims, any of your healthcare costs. You can use any provider that's Medicaid certified. Very few people in Badger Care, though, are allowed to stay in fee for service. The state has made, and that's on my next slide, most of the people are required to actually pick an HMO. And the reason they did that is because it's been found that when members are in HMOs, we have all this big system to really help people navigate the system, find the providers they need, sometimes control costs, and we can talk about what that looks like. And so it's more cost effective for the state to have HMOs in place. And so that's why the state will decide, especially in this Badger Care population, once you get in, you've got to choose an HMO. Now the state puts a lot of regulation on us. We are required to cover everything that's medically necessary for our members. All the medical, behavioral health, all those things that we cover, hospitalizations, outpatient, all those types of things. There are some things that HMOs do not cover, and the state still covers directly. Now, to a member, they can't tell that the state is paying for it or we are, but there's certain things like we don't pay for all the drugs, pharmacy costs, we don't pay for residential treatment for substance use, prenatal care coordination, that's still paid directly by the state. Nonetheless, members very rarely know what pot it's coming out of, but just so you know, there's some things that are a little bit different. The things that HMOs can do that when somebody's in fee for service cannot do is a lot of times we do offer more care coordination. We've got a lot of nurses here, a lot of social workers, community health workers. We're going to try to help you make sure you connect to your providers. If you really have some complex needs, we're going to try to jump in and offer that support to you to help you get the care, get the support that you need. We also have specialized programs. So like we have a mom baby program, and that's kind of why we're here, because we have a whole care management team just built around our pregnant members and supporting them through pregnancy and postpartum. And then a lot of times the HMOs sometimes will have extra goodies they can offer. Most HMOs, if a member's in an HMO, they won't have office copays. They still may have pharmacy copays, but they shouldn't have office copays when they go in. Some have things like 24-hour nurse line.
Why, I don't know.
And then things like, I know I saw Sarah Fox on medically tailored meals. That's something we offer after hospitalization or for pregnancy. And we have partners like Food for Health, where Sarah's from. So yeah, thanks, Sarah. So there's a few of us HMOs out there that are working with the medically tailored meals. So we offer meals to our members who are prenatal and postpartum, and then after hospitalization. So the HMOs, they all have a few of those little goodies tied into them, where in traditional fee-for-service, you wouldn't have that. All right, just a few things about getting in, and I think it's important because often members, because we're out in the community, I'm in Milwaukee, a lot of our teams are here, we do things out in the community to meet up with our members and see them. Most people have no idea what HMO they're in, and it's totally understandable. They just know I have a Forward Health card or something, but they don't even realize that they're an HMO. What happens is when somebody gets into Badger Care, in those first 90 days, it's considered open enrollment. They're allowed to choose which HMO they want to be in. Now, most people don't even realize they have that choice. Even if they know they have it, they don't even know, how do I pick one? There is information out there on the DHS website. But most people don't do that. And what happens then after 90 days is the state will automatically just pop them into an HMO. I think it's some sort of random assignment. We don't know how that works. But what will happen after 90 days is somebody will just be assigned an HMO. So a lot of times members don't even know that that happened, and they have this company that they can call to get support. But once they're in that HMO after that 90 days, they're locked in for the next 9 months. They can't change out of that HMO except for certain circumstances. They're locked in. After 9 months, they should get a letter and saying, hey, open enrollment is happening again, and you can choose an HMO if you want to switch. That should happen, but they are usually locked in. Anytime then during that open enrollment period, or even if they have questions throughout the year, there is an enrollment line. You can go online to Access Wisconsin, or you can call the HMO enrollment line, or you can mail and fax them, and I don't have that information. But that's how you can get more information, or how you can change your HMO if you choose to. In Milwaukee, these are the Badger Care HMOs. So we have a lot of them. And I work with other state Medicaids, and we're a state that has a lot of HMO options. Some states just have 4 for the entire state. In Milwaukee, these are our HMO options. So somebody is in Badger Care, these are their options that they get to choose from here in Milwaukee. The interesting thing is the way DHS does it is each HMO has to apply to be a Badger Care HMO in that county or in a region. So these HMOs are not all in Dane County, possibly, or Brown County, or way up in, I don't know, what's way up north. It's different in every county, but these are the ones that are here in Milwaukee. And then just some of the things I wanted to share with you that there's a lot of things that all of the HMOs have to do and are required to do, but I thought I'd just touch on a few that might be helpful here. All of the HMOs are required to have some sort of care coordination. So they all have some sort of care management happening. It could be for certain populations or whatever, but if you're with a member that you feel like might need more enhanced case management or some support, you could try to reach out to their HMO if you know that they have a Badger Care HMO and they've given you permission. We can't just talk to anybody. We're bound by HIPAA, but if the member's with you or something like that, and you want to ask if they have any care management support, you can always call and see if that's there and if that's something that's available to the members. We do, like on our team, we have a team that works with our very complex members, and we staff those members every week. We have community health workers that will go out in the community. We have a housing navigator that will help people try to find housing. It's so hard, but we'll at least get out there and bring applications out, things like that. We have nurses, we have social workers, so we'll address the medical, the behavioral, and the social needs. And we really like to collaborate with who else is in this person's life. Like, a lot of times people know it's the insurance company calling and they just want to shut us out, but we can actually bring, a lot of support to that member's world. So we really like to see who else is doing that and like, let's all work together to get the support and resources that this member needs. So just know that that's out there. Also know that all new members, when they join us in any HMO, we will be calling them or trying to contact them to complete a health risk assessment. It's a lot of questions about all their health, their behavioral health, their medical, their social needs, their abilities to take care of themselves, their social supports, their language requests. It's a long process and it drives our members nuts, but we have to get it done. And it really gives us some baseline information about how they're doing and how we can plug in to support them. So we do that. We are always here to help members find providers and plug into support. So if you're working with somebody that they are struggling to find a provider for any type of medical or behavioral care, healthcare, and they're in an HMO, contact that HMO with them, and they should be able to help you find the care that you need, that member needs. And then again, we usually all have some sort of specialty care management. On top of just that, a lot of us probably have maternal child health care management. A lot of us are focused on our pregnant and postpartum population. So we may have specialized teams just working with those members. And so if, again, you want to see if there's somebody already working with a member there, or you think your client or individual you're working with might need more support, reach out to that HMO to see if they're doing something with them. One of the reasons that we're really focused on our perinatal population is that all the HMOs have a number of quality requirements that the state puts on us. And these are great. I mean, they're really good stuff, but there's a business incentive because there's a financial implication if we don't meet certain benchmarks. And I put all of our quality measures here, and there's a whole lot of letters here, but I'm not going to go through each one. But I put a square around our maternal health one, and that is we are responsible for our prenatal population to make sure that they get a timely prenatal appointment either within their first trimester or within 45 days enrolling with us, and a timely postpartum appointment within the first, I can't remember, I don't know, it's within the first 6 weeks after delivery. If we have a certain percentage of our population that don't meet like a certain threshold, we get a financial penalty. So all of the HMOs are the same. There's a lot of incentive for us to work with this population and make sure they get their care. At the same time, those of us that are nurses, social workers, community health workers, we know how that important how important that care is. So we really want to work hard to help our members plug in and get that care. But just so you know, oops, sorry, you're seeing all of my other stuff. That those are incentives that are very important to HMOs, and that's why they're also eager. They should be at the table and eager to work and partner to make sure we're getting good care for all of our pregnant population. Last, I just also wanted to tell you that all of the HMOs are required to have two very big quality accreditations. One is called the NCQA Health Plan Accreditation, and that is just overall is a ton of quality requirements we have to meet for a number of different reasons. But the other big one is a health equity accreditation. And we all have to maintain this, and it means that we're looking at our health disparities and we're trying to do something about that. It also means that we should be addressing the cultural and linguistic needs of our populations, and we should also try to make sure our provider network is reflective of our populations and can meet the cultural and linguistic needs of our populations. So that's really important. And so just want you to know we're held to that standard, and that's really important. And so we work towards that. And again, why we want to partner with the community to make sure that that's available and our members are supported. Um, and I think that's it. I know that was a lot. I think that's all I have. But I am open. That might have just confused you more. But if you have any questions about Medicaid, HMOs, I'm open to that, or happy to, if you find my name or email in somewhere, feel free to shoot me an email. Happy to chat about whatever, because I still confuse myself every day around all these benefits, and I've been in this for a while. So happy to take any questions if you have them.
Could you maybe share a little bit about eye care specifically's like mom baby programs, just since that is your area of expertise?
Sure, yeah. And I know you asked me about that, Melissa, and I get really a little nervous. Like I have to be careful. We're not just selling our wares, but since you asked me, I can offer. We do have a mom baby program. So anytime we can identify a pregnant member, we are going to attempt to do outreach to that pregnant member, a telephone call. We have social workers and nurses and community health workers on that team ready to help. So we try to find them, we try to contact them. It's actually really hard for some of us to find our pregnant members. We do sometimes get notices from clinics when somebody is pregnant and they'll let us know. A lot of times it's through claims that we'll see a claim come through that maybe this is a first pregnant or that a member's pregnant. But the way that providers can bill for pregnancy and postpartum care, they can bundle it all and they can submit it late, like after the baby's born. So sometimes we don't even know. It's really hard for us. You'd be amazed at all the different ways we try to find our pregnant members. So, but once we know, we do our best to outreach to that member, call them. We do go through a little bit of an assessment. We want to see how they're doing and see what kind of needs they have. So we ask about their medical care, behavioral health care, their social needs, what's your support? And then wherever those gaps are, we do our very best to work with them to try to plug those gaps for them. They don't always want to work with us, as you can understand. We have really great, compassionate staff, but at the end of the day, sometimes people have got a lot going on and they don't need us or want us in their life. We are very happy to say we are here whenever you need us. Don't hesitate to call. We probably will outreach again, maybe every trimester, just to see how things are going on, how things are going. But sometimes not everyone wants us involved. But if they do, then we will continue to telephonically stay connected with them. And then we help them plug in with their medical care, their behavioral care, try to take care of social needs. We'll coordinate care if things are going on. We'll reach out to providers to coordinate care, other community case management, that type of stuff. And then for the baby, to make sure they're ready for the baby, if there's any resources they need. And then after the baby's born, then we really want to focus, is mom doing okay? Is she getting the care, the follow-up she needs? How's baby doing? Baby may or may not end up being on our plan, but either way, we want to make sure that they're doing okay in the family too. So it's a lot of case management, care coordination, up to kind of how the member wants us to stay involved. If we have to do a home visit, we'll come out and do that as well. We have a lot of local staff. But then we usually stay with them through at least 6 weeks postpartum. And then if we feel like there's still a continued need and they want us to stay on, we will definitely stay on and stay in touch with them. If there's a poor birth outcome, we will stay in longer and just touch base and see how mom's doing and how baby's doing too. Again, just dependent on how much the member really wants to engage with us. So long answer, Melissa.
Very informative, though. Thank you. And I'm
Bet.
assuming maternity care is a priority for all of the HMOs because,
Yes.
like you said, that's going to be a large chunk of the members that anyone has. And so they're going to factor strongly into those, payout bundles or however you phrased it before.
Yeah, our quality measures. Yep.
Yeah.
Yep, absolutely.
So then any other questions about HMOs generally, eye care specifically, if she knows about any of the other HMOs potentially?
Are any other HMOs online if you're willing to say hello?
United Healthcare Community Plan.
Hey, thank you.
Hi.
Hey, Angela, you got anything to offer? Anything you want to
No,
speak
I
up for
think
United?
I think you summed it up perfectly.
Do you guys have a mom baby care
We,
management program?
yes, Healthy First Steps.
Nice. And kind of similar telephonic outreach support.
Correct. And we also have CHW who can do field visits as well.
Nice. Thank you, Angela. Any other HMOs out there? Okay, thank you. Well, I'm here. I'm sure Angela would be happy to answer anything for United as well. So feel free to reach out at any time. Happy to chat and just even or collaborate, or if you think you have a member or anything, I'm happy to help at any time. Thanks, Melissa. I'll hand it back to you.
Thank you. I realized I've been off video. So again, I can share my screen again because I believe I put her information on the next one. Oh, got a little jumpy there. So if you would like to take down Chris's information, it's there. Otherwise, if you forget down the line and you're thinking, oh, hey, a few weeks ago I saw from that Medicaid person, you can always get in touch with me and I can help connect you from there. So next, we're going to go to our partner activity survey, which I introduced in the reminder email I sent for this meeting. So we want to do a kind of annual progress check-in. We want to get some feedback from all of you as members of this action team to get your feedback, have the space for you to share your highlights, be able to, you know, elevate any things that you guys are doing that you share. We want to be able to kind of assess the progress that's being made on our action areas, both kind of individually, your organizations, but then also collectively. And then see what's working well with this action team in MKE Elevate and where there is room for us to maybe pivot and improve how these programs are going. So we have a reporting tool available for you guys that, if I can find the chat. Where did the chat go? When I share the screen, it doesn't give me the usual chat box on the side of you guys. All right, well, I did not do, I was gonna use my get out of jail free card and say there's a QR code, but there's not apparently.
If you take it out of presenter mode, Melissa, it won't make it easier.
I'm trying to stop, but the box with all of you guys, I made it too big and it was blocking the stop share button. That was a new one. That was a very silly mistake on my part. Annika was at the ready. Thank you.
In the chat, yeah.
Thank you, Annika. We got it at the same time. So you'll be able to open that. If you see anyone else on this meeting from your organization, we can put up some breakout rooms because we're hoping to get one response per organization. So that way you guys can go and like work together on it or something like that. But we'll give it 10 or 15 minutes to begin or even complete the survey for you guys. And the responses are going to stay open until December 1st. So if you don't get all the way through it today, or if you're thinking, oh, I need to go find this report to find a number, or I need to, you know, chat with this colleague about, you know, what I want to include, things like that, you'll be able to revisit your responses before the survey closes on December 1st. But go ahead and click the link in the chat and My other action team lead colleagues who hosted meetings earlier are fancy and know how to play music during work time like this, but I do not. So I also don't have anything logged in on this computer, but if anyone wants to put their Spotify or anything like that on, you're welcome to do that. I will check back in with you guys at 5:05 and I'll see where we're at. And again, if anyone would like a breakout room, even just to like chat with some other folks, just to like talk through it, sometimes talking through these things can also help. Please just either put it in the chat or, come off mute, where we are happy to put up a couple of breakout rooms for you guys to go into.
Can we have one for Healthy Start? It's like 4 of us on.
Sounds good.
Yeah, I was
Let's
gonna
see
say, Melissa, for MHD like staff, do you want one from MHD or do you want one from a program in MHD?
from each program, please.
Okay. You want to put me and David in a chat together then, please?
Let's see here. I might just start. Let's
Well,
see,
listen, I
is
can open
that
rooms. I created a rooms and I can just open them and name them.
perfect?
The opportunity to join.
I knew that functionality existed. I just did not, I was gonna have to poke around and you already got it. So feel free to claim a room there. Healthy Start was already labeled. And then there's a couple more so that the EFM dad folks can go in there. And yeah, if anyone else
Yeah,
wants, it looks like
David, do you
there's
want
three
to
right now.
join room 2 with me?
And we can probably make some more if folks want, if there's additional interest. Sarah Garner, not to call you out specifically, but it does look like the rest of the Healthy Start folks did join one of the breakout rooms.
Yeah, I just sent you a personal chat in the chat box. I don't see where to join it because nothing popped up on my screen.
I should be able to move you in there.
Yeah, nothing popped up. I just sent you an email.
All right, sending you there right now.
Thank you.
How are we doing progress-wise? Let's do maybe a thumbs up react if you're done, or a heart if you need more time. Like the
We need a little
like
more
the
time.
the handheld ones. That's the benefit of being on video. Okay, we'll do 5:10 and I will check back in. And remember, this is going to stay open after today, so you will be able to continue working on it. All right, go ahead and try to wrap up your last thought. If you're still typing something in there, leave some notes for yourself if you're going to revisit it to add more later. But I do have something else that we are hoping to get your feedback on. So I do want to keep us going forward. So the Healthy Birth Outcomes Work Group has an update to share. There are 3 work groups on this team, 2 of which have had projects that they've already been working on, and then the Healthy Birth Outcome Group has been taking some time to figure out what they wanted to focus their collective efforts on. And so we have identified a project. It's still somewhat nebulous, so bear with me, to create some kind of inventory or asset map of some sort of MCH initiatives, projects, programs things like that that are going on in the Milwaukee County area. They can cover a span of things like direct service providing organizations, planning and strategic organizations, advocacy, research, across the spectrum. It can be really small scale, like a one person lactation consultancy or a medium-sized agency, or up to a really large scale institution level project. Again, it can cross the span of governmental, nonprofit, business, academic, all across that spectrum to find and collate those folks who are working on maternal and child health in Milwaukee. I want to be very specific. It is not a resource guide for community members to click and say, help me find a lactation consultant. It is for MCH professionals to find each other and be able to kind of see what is happening in the space. So I always want to make that distinction. Resource hubs for community members already exist. We're not trying to recreate that. This is for folks like us working in the space to be able to find each other. So this idea actually came out of the other coalition that I oversee, which is the Fetal and Infant Mortality Review, or FEMR. That also has an action-oriented component to it, and they were having some discussions early on around, if we're going to start to develop some implementation plans for, strategic changes, but we all feel kind of unaware. Like, what if someone is already working on this and we don't know about them? Maybe it's an organization, maybe it's a person. What if we start doing this thing and we don't even realize that someone's doing the exact same thing and we never talk to each other? It was kind of highlighted because Healthy Start, you guys mentioned yourselves. I was invited to a Healthy Start meeting almost by chance, and then they described their program, and I thought, they are doing also the same thing that FEMR is working on. What if we had never met? And so that really highlighted the fact that there's so much going on, and we all want to be taking action to improve maternal and child health outcomes, but we all want to make sure we're taking better action and more coordinated action. We don't want to reinvent the wheel or duplicate things. We want to make sure we're working in coordination with each other. So that is where the idea kind of came from. Again, it's still really nebulous, but we kind of identified these. Example is almost too strong of a word. These are just some things that were kind of like a jumping off point to try to start imagining what this could look like, because when you say an asset map, is it going to be visual? Is it going to be static? Is it going to be like image-based or word-based? If you say inventory, is it like a spreadsheet? Is it a log? Like what is this? What could it possibly be? So these are a couple of things that I'll share that, again, whatever we create doesn't have to look like this. These are just some things that came to mind as potentialities. I realized I didn't actually have to stop sharing. I just needed to click over to a different internet tab. So the National Center is an organization that provides support to fatality review teams across the US. And so this is a map of existing FEMR programs. And so this is geography based. So it's very visual. And so if you want to see what fatality FEMR programs exist in Wisconsin, you click on Wisconsin and you see Dane County, Rock County, Milwaukee County. And if you click this one, the information for our program pops up. And so this is something that this organization sends out. They solicit the information and then it populates into this. And so you can see, I actually learned this yesterday, Florida, my goodness, they have a lot of FEMR programs. So if you're in a southern state and you're thinking, oh, I wonder how my neighbor in Alabama is figuring it out, you can find each other in this way. Again, this is a national scale for a different purpose, but it shows those categorizations kind of, and how you can kind of choose some filtering. Since we mentioned a resource hub, we also thought about Well Badger. again, this is one where we're like, we do not need to be a resource hub. 211 exists, Well Badger exists. They are both fully resourced to find those services for folks who need any kind of social service. But this is just another example of a list. So where was it? Up at resources, they have a handful of categories that they, initially put their resources into. And so you can choose your category. And then they have a further list of, I have too many things open right now, so that's why every website is taking a bit to load up. Once this loads, it's going to show a further list of types of services. So again, that layered categorization, as it were. Across the pregnancy ones, the wide range of services, birth centers, childcare, doulas, foster care, Head Start, healthy families, infant loss, kinship care. And they have these categories for, these other groups of services as well. So, if you pick one and go, this is also a statewide program. So there's obviously going to be quite a lot. We are going to focus on Milwaukee County because we are a group of people volunteering our spare capacity. So we can't, take on something to support the entire state from the get-go. But this is also a bit geography based because you can search by county or zip code. There are multiple ways to search on the Well Badger platform as well. So those are kind of some things that we thought of as other samples of these kind of category-based ways to find resources. So if it'll click back to my slides.
Melissa,
Yes.
I believe medical college is working on something similar. I don't know if I don't think it might not be to the same breadth or extent that this team was looking at, but I can connect you with them to see what
Very
they're
much.
aligned.
Absolutely, please do. We might be able to join teams or bounce off of each other or be complementary or whatever it might be. And just making a note so that if nothing else, I can remember to follow up with you too.
Melissa, I just put something in the chat too that we'd be happy to share our data.
When I'm sharing the screen, my chat
Yeah.
disappears.
Okay. We had an intern actually this summer that was paid who created 5 maps for us around doulas, midwives, mental health, substance use, and birthing hospitals statewide. Those maps are going to go live probably this winter, but I have all the raw data, so I'm happy to download it and send it over to you for Milwaukee County if you'd like. If it feels like you're going to be doing like mapping pieces. With the same intention that we're not keeping the maps as a resource. We don't have the mechanism to update them that frequently, but it's really just to understand the scope and landscape across the state. So,
and those are some categories that we have tossed around there. We've thought about other ones a little broader than just that, but those are a great jumping off point. To still continue the conversation a little bit, we, upcoming, we are not fully certain what this final product might be. Learning this new information, maybe it'll live with a different organization. Maybe we'll be partnering with someone or at the very least informing someone else. There's already more information coming out in this meeting, which is perfect. This is what we want. We want people in the room so we can know what is going on. Some further questions are, how would people get their initiative listed on there? And then how would it be updated? Would it be updated? How frequently? What would that mechanism be? Keeping the sustainability of the project really front and center, because again, this can't be something that's so unwieldy that it takes a whole staff to you know, keep it living if it is going to be a more dynamic thing. It could be a static list or a searchable PDF or, you know, something like that. So there's still a lot of information to figure out, decisions to make, but we wanted to get some input from this room of professionals working in the maternal child health space. Get some ideas from you guys. I am glad I already did this. I pulled the questions I have, so they're already in my notes and I can copy and paste because I want to be able to see the chat. So the first round, well, okay, to start, I believe it was Akanil yesterday shared the concept of a chatterfall, I believe it was called.
Yeah.
So we are going to do, you know, everyone's going to answer each question, each discussion question as I pose them. You're going to type your feedback, your response in the chat, but don't hit enter right away. I'm going to give you guys a little set amount of time, and then I'll give you a ready, set, enter. And then everyone will hit enter at the same time so that chat explodes. And then we can all scroll through and explore together and have a discussion. So we might actually do this kind of quick, and we might do all three of my discussion questions because I just looked at the clock. So I'm going to get the first one in the chat here. What would you use a tool like this for? Would you use a tool like this? How would you use it? You know, for what kinds of purposes? Who would you search for? How would you want to be searched for? Really, that first question is kind of the big one. Would you use something like this, and for what? So we'll do maybe 30 seconds about, it can be a longer, it can be like short single words in your chat, or you can, you know, kind of put a few sentences if you want. So I want to give you some time so you can let the idea soak. So type it, do not enter it. Ten more seconds. And ready, set, enter. Oh yeah. Double bonus is Zoom automatically saves the chat logs. So I'll be able to go over these after the fact and make sure I don't miss anything. I mean, the first one that came through is from Vision Forward, who perpetually feel like folks don't know about them, and I've tried to promote them here as well. There is a real gap in vision services for the very young children, and so folks should definitely know that Vision Forward exists. Melissa, you just want to cross-reference your own maps? Partnering and outreach, being able to search by topics, that is definitely something that we've been thinking, is the searching by topics and having those different levels of filtering. So like I'm looking for research, or I'm looking for PNCCs, and then just how would we organize that and arrange that? Community partners, making connections. There is a lot of desire to find partners, find connections. I see yours, Katie, and they're very important to be able to have a mechanism to keep this up to date in terms of that contact information, because if you can't get in touch with that organization that's on a list, the usefulness declines a bit. Thank you. Now I am going to start adding a couple additional ones. So if you want to give thoughts on previous questions, just kind of put in your comment what you're referencing here. But discussion question 2, going in the chat here. What would make this kind of tool useful and usable? What kind of appearance do you think you can envision it to have? What kind of format? How would it be organized? How would it, what would it be to be useful and usable? I'm saying both because in my mind, they're a little bit different. If it's too complicated for you to navigate, no one's going to use it. So how can we make it good and workable? Do about 30 seconds. Having you guys do the work for us. Brainstorm. Ten more seconds. I know we're getting crunched at the end here. Those of you who know me should not be surprised. These are how my meetings frequently go. So I understand if folks have to leave right at 5:30, I will get this last question in here so you can at least type your feedback here, and there will be a follow-up sent out. Question 2, what would make this useful and usable? Get ready. 1, 2, 3, enter. I'm already seeing multiple folks mention something visual, something well organized like Well Badger, maneuverability, location searchability. I don't think that came up before, so that's good. I'm not going to promise we can make an app. That's a big dream. I like the suggestion, but I'm not going to make promises. And then again, because I do want to make sure everyone has a chance to see that third question that is in the chat here. We don't have to do the Chatterfall for this one. You can just kind of put stuff in there because I feel like there might be less ideas here, but feel free to surprise me. How could something like this be created? And where would you think to go to find it? So maybe those could have been 2 questions. Feel free to answer them separately if you want. If there's anyone kind of tech-minded or something like this who has ideas about how this could be stood up and then maintained, I would love that kind of feedback. And then for those of you who would want to use something like this, where would your brain say go to find it? That kind of information. So again, we don't have to do the chat activity. You guys can just put it in there. I'm going to get us back into the slides just to bring us to the wrap-up information. I do want to remind us also real quick, I have drafted the Google site for the MCH Action team. So this should not be editable for you guys. It's more of a resource hub for this action team specifically. So you can see the different goal areas and you can see what the projects for the work groups are. Those are listed here. If you're like, oh, who was working on that asset map or inventory project? You can see a calendar of our upcoming meetings. If you have a program flyer or something like that that you would like posted, you can send it to me. This is more for like long-standing ones, not like I have an event coming up next week, more so like we have a weekly event or something like that. And then I also put the previous meeting materials. I have not worked backwards yet, so 2023 is still empty, but there are meeting notes, meeting slides, and then for folks who sent the presentation separately, the partner presentation will also be listed. This has been sent out, I think in at least one previous email, but I will share it out again. So again, that is just a Google site. It's just a pretty looking face for a Google Drive. And you guys can kind of access some quick use things if you're ever trying to think about like, oh, hang on, what was the action team working on? You have a place to go for that. Reminder about the work groups and implementation partners. These are, always rolling. You're always welcome if you or your organization decide you want to take that little extra step of commitment to sign up as an implementation partner. You are welcome to do so. It's not something that has to go to your lawyer or anything like that. It's just a statement of, our work is aligned and we want to, have that additional level of accountability with the MKE Elevate project. And if any of the work groups sound interesting to you, or something you want to work in, please just reach out and we can see about getting you onboarded into any of them. It is a little bit additional level of commitment, some time commitment, and possibly delegated tasks. So I like to make sure folks are aware of that. The last meeting we have coming up in 2026 is on December 4th. That is our general member meeting and end of year celebration. That is where all of the action teams come together, and community members are also welcome, where we kind of wrap up the year for MKE Elevate. You can hear from the other action teams, which I know we don't always get to do a lot of. Another time to see each other, network a little bit. There's going to be food. So the information for this will be shared out in the follow-up email. And then if you want to scan this QR code, it is just a very brief meeting evaluation. I can put the links here. No, I can't. Okay, I found the chat. It came back to me. Annika put the registration link for the general member meeting in the chat, so you can click that if you want to register now. I just shared the link to that MCH team Google site, so you can pull it up and, peruse it a little bit. If the QR code isn't working, you can click this link in the chat for that evaluation. Thank you to those. I did see I got some comments on that third discussion question. Thank you so much. I will get into those after this. And I am able to stay a little bit if anyone did have any last minute thoughts. I'll keep the chat open too if you still have ideas you want to pop in there. Otherwise, thank you so much, everyone.
Thank you. Take care.
Thank you. Have a good night.
Thank you. You too.
Good night. Have a good weekend.
Thank you.
We're almost there. Just Friday left.